Have you been told you have high blood pressure during your pregnancy? You're probably wondering what exactly that means for you and your baby. Here's the thing, not all pregnancy hypertension is created equal. Today, I'm breaking down the three main types so you can understand which one applies to you, what to expect, and when you might need to call your doctor right away. Hi everyone, Dr. Maria here. When we talk about high blood pressure in pregnancy, it's not just one condition with one treatment plan. If you're pregnant and have high blood pressure, you actually fall into one of these three different categories. Pre-existing hypertension, also called chronic hypertension, gestational hypertension, or preeclampsia. Each type has different implications for your pregnancy journey, so let's walk through them one by one. Let's start with chronic hypertension, also known as pre-existing hypertension. This is exactly what it sounds like. High blood pressure that existed before your pregnancy or showed up before you hit the 20-week mark of pregnancy. Maybe you've been managing this condition for years with medication, and if so, that's fantastic. But here's something important to understand. Even if your blood pressure has been perfectly controlled with medication, you're still classified as having chronic hypertension during your pregnancy. And why does this distinction matter? Because pregnancy completely changes the game for your cardiovascular system. Your heart is working harder than ever before. Your blood volume is increasing dramatically. We're talking about 50% more blood flowing through your body by the end of pregnancy. That's why your doctor needs to monitor your numbers more closely now, even if you've had things under control for years. Now let's talk about gestational hypertension, which is a bit different. This type only appears after the 20-week pregnancy milestone, and the tricky part is that it often sneaks up without any noticeable symptoms. You might be feeling completely fine, no headaches, no swelling, nothing out of the ordinary, and then your doctor tells you your blood pressure reading is elevated at your routine prenatal checkup. It can be quite a surprise where there are no obvious signs. The silver lining here is that for most women, gestational hypertension disappears after delivery. Once that baby is in your arms, your blood pressure often returns to normal within a few weeks. But we still need to watch it very carefully throughout your pregnancy, because there's a possibility that gestational hypertension could progress into preeclampsia, which requires more intensive management. Preeclampsia. All right, now let's talk about preeclampsia. This is the type of pregnancy hypertension that requires the closest monitoring. Preeclampsia happens when the placenta, which is essentially your baby's lifeline, doesn't receive adequate blood flow. To compensate for this problem, your body raises your blood pressure, but unfortunately, this solution comes with its own set of complications. What makes preeclampsia different from other types of hypertension is that it's not about high blood pressure numbers. There are additional red flags that your doctor should be looking for, such as protein in your urine, in which we can detect through a simple urine test, in where we measure the albumin to creatinine ratio in a morning urine sample. Also, preeclampsia may present with unusual changes in your blood test results that might indicate your organs aren't functioning as they should. Some of the symptoms are persistent headaches that won't go away with typical remedies, changes in your vision like blurriness or seeing spots, or pain in your upper abdomen, particularly under your ribs on the right side. I have a dedicated video on preeclampsia on this channel. You can check it out. Now, I want to be clear, preeclampsia exists on a spectrum. Some cases are mild and can be managed with more frequent checkups and closer monitoring. Other cases are more severe and require hospitalization to prevent serious complications. What kind of complications are we talking about? The two most concerning are eclampsia, where the high blood pressure becomes so severe that it leads to seizures, and this is a medical emergency that requires immediate attention, and HELP syndrome, which stands for hemolysis, the breakdown of red blood cells, elevated liver enzymes, and low platelet counts. This condition can severely impact your liver and blood clotting abilities. Here's something that catches many women by surprise. Preeclampsia doesn't always develop during pregnancy. It can actually appear after delivery, sometimes up to 6 weeks postpartum. That's why your postpartum checkups are as crucial as your prenatal appointments. If you've already had your baby and noticed symptoms like facial swelling, severe headaches that won't go away, changes in your vision, or sudden weight gain, please call your doctor right away, even if everything else seems fine. Don't just chalk it up to normal postpartum changes or lack of sleep with a newborn. It's always better to make that call and have it to be nothing than to miss something important. The good news, after all that serious talk, I want to emphasize some good news. The vast majority of women with chronic or gestational hypertension go on to have healthy pregnancies and healthy babies with the right monitoring and care. Medical science has come a long way in understanding how to manage hypertension during pregnancy. Your healthcare team has many tools and strategies to help keep both you and your baby safe throughout this journey. The key is staying informed, attending all your prenatal appointments, and communicating openly with your healthcare providers about any symptoms or concerns you experience. Think of yourself as an active member of your healthcare team because you absolutely are. If you want more detailed information about managing hypertension during pregnancy, I have a comprehensive course that guides you through everything from diet modifications to understanding your medication options and recognizing warning signs. You'll find the link in the description below. Remember, knowledge truly is your superpower during pregnancy. The more you understand about your condition, the better equipped you'll be to advocate for yourself and your baby. Go to your prenatal visits prepared with questions, track your symptoms at home, and never hesitate to reach out to your healthcare team if something doesn't feel right. You've got this. See you in the next one.